Hi, everybody. I'm Dr. Kimberly Olson, licensed clinical psychologist. It's been a while since I posted, but there's been an issue of concern that I want to talk with you about. Something here on the YouTube universe that I have been noting concern, not just from me, but from a lot of you, and that is Miss Eugenia Cooney. Now, obviously, my concern first and foremost has to do with the weight issue. And obviously, while I am not her psychologist, and I certainly don't want to diagnose anyone, but rather speculate, I don't think it requires a brain surgeon to see that she's got some profound eating disorder issues. My concern is that these are not being treated or addressed. And while we can't make her address these things, there is something that we can do to help, and that is stop watching. Because the truth is, she's got over 2 million subscribers. And it isn't because of the amazing tutorials on makeup and her sweet, albeit charming personality. It has to do with the fact that she is, when you look at her, kind of an oddity. She's a person that you're going to say to your friends, oh my God, look at her. There's something wrong with her. And so when we're watching, again, we're not watching necessarily for content, but watching to observe this person that a lot of people are reasonably worried about. Okay. Well, there's a couple of things, and they are consistent with the potential diagnosis of anorexia nervosa. She appears to be in a state of arrested development, while 29 in chronological years. When you look around her room, the way that she approaches things, the way she talks, she seems to be quite young. And that's a state of arrested development, which is often associated, and again, this may not be the case for Eugenia, but is often the case with folks that have withstood some sort of trauma. And so it's of concern. Also, it seems like she has come to define herself by this trait and characteristic. Again, we're not watching for makeup tutorials or her opinion on the latest and the greatest, whatever the case may be, but everybody's watching to see what happens to Eugenia. How can she begin to recover when she's defined by her disorder? When her bread and butter is dependent upon her disorder? When her popularity and her appeal come from having this disorder? There's not a big motivation to recover. If you're going to lose your job, your resources, your means of social support, uh, your means of having connection to the world, okay, it makes recovery quite loaded. Why would you do that? Why would you recover if that means you're going to lose all of those things? So my prayer would be that she could come to define herself in a different way, but the only way that's going to happen is if we stop reinforcing it. We stop reinforcing it by not watching, by not reinforcing it through likes. It would be very difficult to recover again if your whole identity is built upon this. So give it some thought. If you're really interested in helping Miss Eugenia, stop watching, stop subscribing, stop reinforcing. My prayers are with her. Thank you.